So someone asked us about macular sparing, and this is a super important concept in visual fields because it helps with localization. So when we have a visual field that is a homonymous hemianopsia, in this example, a left homonymous hemianopsia, if the field defect runs right down the middle and involves this central 5 degrees, that we call macular splitting. Macular splitting. So this is a macula splitting homonymous hemianopsia on the left. If, however, we have sparing of this central portion, even though you still have a left homonymous hemianopsia, you have sparing of this central 5 degrees or 10 degrees, and that we call macular sparing. Macular sparing occurs in occipital lesions for a number of different reasons. However, whenever you see this macular sparing, you should really be considering the possibility that the lesion is in the cortex, in the occipital cortex. And the reason is this part of your cortex, the tip of the occipital lobe, is where the macula is represented, and it has a dual blood supply from both the MCA and the PCA, the posterior cerebral and the middle cerebral artery both supply this area. And a lot of attention, evolutionary-wise, has been devoted to preserving this central vision. And so macular sparing is very, very suggestive that it's occipital. However, it's not 100%, and you shouldn't use that piece of information alone. Of course, you're going to have clinical radiologic correlation by doing the MRI or the CAT scan to see if we're sparing the tip. But if you have sparing of the macula, you normally have sparing of the tip, and that means the lesion is probably going to localize the occipital cortex. And the way to do it is you do a Humphrey or a Goldman or whatever field, and you see the central sparing. That central sparing is called macular sparing. It's totally different than what you're thinking about macular sparing in retinal disease. In retinal disease, you can have a retinal detachment that is involving or sparing the macula. In macular sparing visual fields, the acuity is going to be 20/20. It has nothing to do with the macula in the retina. It's macula in the field. So both a macular splitting left homonymous hemianopsia and a macular sparing left homonymous hemianopsia both have 20/20 vision. And that's because this part of the macula can still see 20/20. And so when I ask the resident, what is accounting for the patient having 20/20 vision and left homonymous hemianopsia, please don't say macular sparing, because macular sparing or macular splitting both have 20/20 acuity.